Gentlemen of the press, our viewer and listener back at home. Today is Monday, 15th day of November, 2021. Would keep to the pattern of our national briefing. At this point in time, may I please request that we give attention to the chairman of PSC and the secretary to the government of the Federation for him to give us the welcome address. Chairman, sir.
Thank you. Members of the Presidential Steering Committee, distinguished members of the press, ladies and gentlemen, thank you for your patience once more, and we apologize for coming slightly late today. I, however, welcome you to the national briefing by the Presidential Steering Committee on COVID-19 for today, Monday, 15th November 2021. The Presidential Steering Committee has not briefed the nation for some time now, but we have been working and monitoring the trends around the world so that the national response can continue to be based on data, research, and experience. The situation is still challenging, hence the need to continue to strictly adhere to the non-pharmaceutical intervention measures put in place. We are currently seeing some surges in cases in some countries in Europe, especially Eastern Europe, due to under-vaccination. In other territories where massive vaccinations have occurred, the infections are rising. What we see in Nigeria right now is that there is an increase in case fatality ratio, which calls for great concern. In our last briefing, we announced the vaccine mandate for 1st December 2021. I would like to state that this is in the best interests of the nation, looking at what is happening globally. You remember when we spoke about that a couple of, about 2 months ago, there was general outcry as to whether we had the vaccines sufficient to go around the federal public servants and whether it was within our confines to be able to impose what we said we were going to do. Unknown to most people who were questioning the application of that protocol, I believe now minds have changed, looking at what the world is going through and the kind of protocols that are being in place in different jurisdictions. When we speak in Nigeria these days, the world copy. We are gearing up to further engage with the Nigerian Governors Forum to push through the mass vaccination program and mandate for our citizens. We have received intelligence and even detected that some unscrupulous citizens are procuring vaccination cards through the black market, all in an attempt to beat the system, not only in Nigeria, but because most countries are now demanding for vaccine certificates before you are allowed access to their countries. This is not good for us. And I want to assure everyone that the vaccination records and certificates will be verified. And this should serve as a warning to those criminally minded persons to desist because they will be prosecuted accordingly. If you procure a vaccine through the back door and your records are not on the data system, it's just as if you are carrying a worthless paper, because by the time it is scanned, the basic information that is supposed to appear will not be there. So why do you have to go through that process? And in the process, suffer a lot of embarrassment, because if you procure those kind of vaccine certificates for trips, you obviously be picked up. And in some jurisdictions, you might be liable to some form of confinement through prison sentences. In addition to the above, travelers leaving the country are encouraged to be conversant with the travel protocols of all countries: origin, transit, and destination. I urge Nigerians to check up what is the applicable protocol for any country that you are traveling to, so that you avoid a situation where you plan to travel and you are not allowed either to board an aircraft or to go by sea or by road. This has become necessary because of comments and reports in the media that some citizens are denied boarding due to lack of pre-departure protocol compliance. And oftentimes it's because we don't take time to read what has been uploaded on the website of different countries as regarding the protocols for travels to those nations. And most countries keep updating their protocols and changing. So anytime you are destined to travel, please check it up so that you can avoid unnecessary, non-compliant, embarrassing situations. The same goes to those returning home. Also complained about requirements to be met. The protocols are clear, simple, and they should be observed accordingly. Our protocols in Nigeria are the most simple, and they are straightforward. As to whether you are vaccinated double or you carry a PCR test, it tells you exactly step by step what you need to do. And if you comply with that, travels become easy and seamless. The vaccination phase is being accelerated, and the National Primary Healthcare Development Agency has concluded arrangements to roll out a mass vaccination plan with effect from Friday, November 20th, 2021. The Presidential Steering Committee wishes to assure Nigerians that the National Primary Healthcare Development Agency has enough vaccines in the pipeline to vaccinate about 50% of the target population by the end of January 2022. Right now, we have in stock more than 12 million doses of vaccines of different varieties, either AstraZeneca, Johnson & Johnson, or Pfizer. But in the pipeline, through the COVAX and other facilities, by the end of January, we should have sufficient quantity of vaccine to vaccinate 50% of the targeted population. In more details on this subject, the National International Travel Protocol portal has been upgraded to meet existing protocol and demands of our traveling public. The portal is now live and running smoothly. The technical head of the Presidential Steering Committee Secretariat will throw more light on this subject. The Presidential Steering Committee is approaching the end of its 9-month mandate by the end of December 2021. To effectively capture the core elements of our national response, a national summit to end COVID-19 in 2022 and to strengthen global health security is being planned to hold in Abuja here from 6 to 8 December 2021. It is imperative that all hands must be on deck if we must lay a solid foundation for, 1, a sustainable response to COVID, which will be with us for quite some time. Because in the nature of what we have seen with this pandemic, it's not likely to disappear very soon. And 2, continue to push to minimize the impact on health and economic sectors. I now, therefore, call on the Honorable Minister of Health, followed by the DG, Nigerian Center for Disease Control, and the ED, Primary Health Care Development
Federation, directors, executive director, director general, permanent secretaries here present, ladies and gentlemen of the press. The much feared third wave of COVID-19 driven by the Delta virus has come and seems to have withered away. But that does not mean that COVID-19 is gone. It is still around, and reports from outside this country and also parts of inside this country show that we still have to be on the alert. We cannot afford to rest on our oars. We cannot assume victory. And in Nigeria so far, we appear to have been enjoying some calm, but it must not tempt us into thinking that that is the end of the game. COVID-19 is still evolving. Nigeria has so far tested 3,393,457 samples, of which 213,147 were confirmed positive for COVID-19, while active cases are 4,447 and discharged are 205,732. There have sadly been 2,968 COVID-related fatalities in our country. Case fatality is 1.39%. Bed occupancy in the week under review was about 16% in the 86 isolation centers that are reported. And oxygen is widely available everywhere. It's mainly in cylinders. Oxygen concentrators are backup. There is no surge in oxygen demand, and there is no distress in our treatment centers. But a review of the oxygen situation in the total complete 125 treatment centers that we have is ongoing to identify their status, as well as to identify around the country the oxygen plants that are not functioning or not functioning properly, that are to be repaired. Majority of the patients under treatment so far on admission in isolation centers have comorbidities like diabetes, hypertension, obesity, and other non-communicable diseases, which are known determinants of the severity or survival of COVID-19 disease. The same finding has been made in many other countries abroad, and particularly in some Eastern European countries at the moment, where the severe waves of COVID-19 are raging, and it is those countries who have not vaccinated to the same extent as other parts of the world or other parts of Europe. Those are the least vaccinated areas. Whereas in the countries where the infection is even raging, and the majority and the high incidence of infection, the fatality is not so high. But despite the palpable fatigue we see among our citizens on the adherence to COVID-19 preventive protocols, I have already myself encountered so many people who own face masks, but they put it in their pocket or in their bag or under their chin. So it is not the right thing, and the mask is not helpful anywhere else except it is covering your face, that is your mouth or your nose. Global trends around the world suggest that public health measures like masks or social distancing are still very useful, despite having taken 2 vaccinations. They are still extremely helpful in protecting against infection. We are learning every day about this COVID-19. There are countries that have reached 70 to 80% vaccination and are having a very high wave of infections now, and are beginning to order their citizens to start wearing masks again after they thought they had let down their guards. Go back to masks, go back to social distancing. There are many more things that will begin to manifest about this disease until we understand it fully. The present infection surge in other European countries who already had this 60% or above is clearly not a reason to drop our guard, or it's not a guarantee against infection. It is clear that if you are vaccinated, your illness will be much less severe. So therefore, the surprises coming up with the novel coronavirus as it evolves, and Nigeria is preparing along all established avenues, including participating in research and development, and several Nigerian groups are engaged in genomic sequencing, and some are doing vaccine development. Others are planning for technology transfer for vaccine production. NIPRID is working on, that's the Nigeria Institute for Pharmaceutical Research and Development, is working on producing phytomedicines that work against COVID-19. And the Nigeria Institute of Medical Research is currently doing some research in what they call fractionated vaccines doses, working together with an American research group. So there are partnerships growing with foreign research groups to increase knowledge about COVID-19, to increase knowledge about treatment, and knowledge about what works and what doesn't work. Some people may have heard of a pill that is being developed for treatment, about which much knowledge does not yet abound, or of new vaccines that may not need to be injected but can be sprayed or put as a nose drop. All these are just brand new, just about being made very public. Nevertheless, the most potent tool so far to save lives remains, first, full vaccination in the prescribed intervals. If you are told to come back in 2 weeks, 4 weeks, 6 weeks, keep to that and do not change it. And vaccinations have gone on around the world. Billions of doses have been given, and no terrible incidents have taken place. Therefore, nobody should be having doubts about these vaccines anymore. The vaccines we use here in Nigeria are trusted. So I urge all citizens to drop hesitancy and take the vaccine. It is commonplace in many foreign countries now to ask for proof of COVID-19 vaccination before you can be admitted even into a restaurant or cinema or a nightclub, or in some cases to board aircraft. It's happening already for international travel. This trend is intensifying as people seek to protect themselves and protect their assets and their business. It's intensifying around the world, and I'm sure, no doubt, it will begin to come into Nigeria very soon. I will not be surprised if even domestic airlines at one time soon start demanding vaccination card before allowing boarding. Therefore, advise that anybody who doesn't want to be left out or doesn't want to be embarrassed should take your vaccination and do not be left behind. This trend is coming, whether we like it or not. Availability of vaccine for the willing will not be a problem anymore in the foreseeable future. In Nigeria's vaccine manufacturing aspirations are still very much on track, and we're working with private sector and also with the full support of influential Nigerians in high places. We had a meeting yesterday on how to push Nigeria's vaccine manufacturing ambition. So again, I want to once again advise that we should not declare victory and lay down, drop our guard. They have been talking, as you know, scientific community, about the need for a booster dose. When the vaccination started, nobody talked about that, but the evolution of the COVID infection brings more knowledge and more needs and more awareness. And after they have been well studied and established, we shall also introduce them into our country and advise our citizens to participate. COVID-19 is going to be a long haul, marathon. It is not a sprint. And the most sure way so far that we will use in combination are the vaccinations and the non-pharmaceutical interventions we must unfortunately still adhere to. Thank you for your attention.
Chairman, Presidential Steering Committee on COVID, the Secretary General of the Federation, Honorable Minister of Health, Permanent Secretaries, Directors, Chief Executives, colleagues, members of the press, fellow Nigerians, and all listening. I am honored to address you all for the first time in my capacity as the new Director General of the NCDC at this Presidential Steering Committee on COVID briefing. I remain grateful to His Excellency President Muhammadu Buhari for the vote of confidence in appointing me to this role, and I'm also grateful for the warm welcome I've received from the SGF and from my principals, the Honorable Ministers of Health and Minister of State for Health. To my colleagues in other ministries, departments, and agencies, I would like to thank you for the work that has gone into the response to the COVID pandemic so far. And my thanks also go to the team at the NCDC, which I must publicly acknowledge for the great shift of work they've put in so far in and under difficult conditions before and especially during this pandemic. As has been highlighted already by the SGF and the Honorable Minister, the country has indeed made tremendous strides in building its capacity to prevent, detect, and respond to diseases of public health importance, especially for, but not limited to, COVID-19. However, I must reiterate, as you've already heard, that there's still a lot more work to be done in sustaining the response to COVID-19 and for preparing for future outbreaks. The NCDC will continue and continues to deliver on its mandate to protect Nigerians from the deleterious impact of diseases of public health importance. And this continues to be greatly facilitated by the support of the federal government through collaboration with sister agencies and partners. And as you know, some of the actions of the NCDC in response to this pandemic so far are not limited to continued surveillance of cases with our digital surveillance tool nationwide, continued support for diagnostic capacity in terms of ensuring that our network of labs continue to be able to diagnose COVID. There's also the more recent expansion of COVID testing through the deployment of rapid diagnostic tests, all in a bid to improve surveillance and our efforts to generate the required evidence for interventions. The NCDC continues to manage the national stockpile for infectious diseases and continues to deliver much-needed commodities to our states and other partners in response to support the response to the outbreak. And of course, we cannot say enough about the communications that have happened since the beginning of the pandemic and continue still to ensure that there's transparency and openness in our reports of what's going on during the pandemic. As you may know, there have been so far over 251 million COVID cases worldwide. For those who are interested in history, this is about half of the total population that was affected by the Spanish flu or the influenza pandemic in 1918 to 1919. Thankfully, with research, scientific innovation, dedication, and commitment, part of the response to the pandemic was the quick, and I say quick, but not rushed, development of safe vaccines. However, although there have been 7.1 billion doses of vaccines administered globally, this has offered a means of exit from the pandemic, of course, in combination with all of the other measures earlier highlighted by the minister and practiced by many in this room already: mask wearing, physical distancing, etc. For Nigeria specifically, we have recorded a little over 213,000 cases. Thankfully, majority of these cases, 205,000, were either not sick or they made a full recovery from whatever symptoms they had. But what is important to remember is that we've lost 2,968 Nigerians. These are parents, siblings, close relatives, colleagues, neighbors, all sorts of relationships to this disease. As at 13th November, 5.8 million Nigerians had received their COVID vaccines, and you'll hear more about COVID vaccines from my colleague from the MPHCDA. However, while access to vaccine and, of course, the associated vaccine coverage is not living up to the ideals of equity that is required to assure global health security, and this seems to be making the news more, I think it's important that we highlight that it is essential that we play our part by making sure that we use all of the opportunities on offer, as already mentioned, to get vaccinated. Now, I'd like to specifically address the laxity with compliance to public health and social measures for COVID. We cannot deny that there are many Nigerians who still react to any reference to COVID-19 with disbelief, and we appreciate that the pandemic has had not just consequences for health, but for both personal and national economy. And of course, as a consequence, there is substantial or considerable pandemic fatigue. Regardless of the foregoing, the situation is one where the reality cannot be denied, and that reality is that this disease exists. The virus is real, and unfortunately, it still makes people sick, and thankfully, in much fewer cases than expected, it actually kills people, fellow Nigerians. In addition, the more transmissible version of this virus, called the Delta variant, is dominating worldwide and here in Nigeria. And in fact, this variant was responsible for our third wave as seen elsewhere. But what we need to remember is that that variant emerged from a situation of unmitigated viral transmission in populations, in communities. So although we've been spared the worst of COVID-19, and I say spared because things have not panned out to the really negative predictions. But what we need to focus on is that if we do not sustain the recommended measures to mitigate this outbreak, we will continue to remain at the high risk of emergence of new and even more dangerous variants than the Delta variant. And it will delay our return to normalcy. And we talk about normalcy in terms of travel, investors coming, complete lifting of restrictions, and so on and so forth. And I'd like to just provide an analogy for the situation we find ourselves in. Everybody knows about hypertension and diabetes. And what people may also remember is that these diseases are also described as silent killers. The reason why they are described as silent killers is because they cause little or no symptoms for a long time in many people. But behind the scenes, as we know, they are damaging blood vessels, damaging the heart, damaging the kidneys. And this is why, for many cases, the first presentation in hospital or first knowledge of the fact that they had this underlying condition is that they either have a stroke or a heart attack or a diabetic coma or collapse suddenly without reason. And what is usually said is, oh, he or she was very healthy and not sick or never sick. And this is the same scenario we have with this virus. It is present here. Community transmission is occurring mostly silently, but we should do all we can to prevent the emergence of SARS-CoV-2 variants that will be capable of evading all of the immune protections that we currently enjoy. Please note, as has been highlighted by others, that countries have continued to experience sudden surges in cases as a consequence of the poor use of safety measures and, of course, inadequate vaccination. So, I would like to implore you all, fellow citizens, in all of your respective spaces, personal, official, corporate, or otherwise, to ensure good hand hygiene, good respiratory etiquette, and to wear your face mask, not just to burden ourselves to serve as an inconvenience, but as a protective measure that can reduce the spread of this virus in particular through droplets and aerosols when we breathe, when we speak, and
agencies, distinguished ladies and gentlemen, I want to particularly say good evening to our members of the press, and I welcome you wholeheartedly to today's update on the COVID-19 vaccination. As of this morning, Monday, November 15th, 2021, a total of 5,891,305 eligible persons have received their first dose of the COVID-19 vaccine. This represents only 5.3% of the overall eligible population, while only 3,252,067 people have received their second dose and are therefore fully vaccinated. This represents only 2.9% of the overall population of eligible persons. As we are all aware, the overall population of eligible persons targeted for the COVID-19 vaccination to enable the country to reach herd immunity is 111,776,503. Looking at the aforementioned figures, it is extremely risky for us to go into the end of the year festivities, which will involve a lot of travels, crowded gatherings, and reunions without adequate measures to ensure that people are protected against COVID-19. As we move towards the end of the year, it has become necessary to repeatedly emphasize the need for eligible Nigerians to get vaccinated against COVID-19. We have all come to agree that COVID-19 exists and is evidently fatal. Some of us have lost our friends, family members, and colleagues to COVID-19. This pandemic has remained a formidable obstacle to the smooth conduct of our businesses, education, and personal living. More than any other disease in recent history, COVID-19 has generated protracted global economic downturn and social inconveniences that impacts the most on developing countries such as Nigeria. It will be difficult to recover from all of these adversities if we do not take aggressive measures to control COVID-19 in the shortest possible time. This is why MPHCDA, in collaboration with the Federal Ministry of Health and the Presidential Steering Committee on COVID-19 Response, has initiated the COVID-19 mass vaccination campaign. As I mentioned during my earlier briefings, the idea of mass vaccination campaign is to quickly increase the number of fully vaccinated eligible Nigerians, thereby rapidly moving towards achieving herd immunity and creating an enabling environment for economic recovery and the return to social normalcy in the shortest possible time. However, the mass vaccination campaign will require mass mobilization of Nigerians to increase vaccination uptake. This cannot be successfully done without the support of all critical stakeholders, including governors, commissioners, the local government chairmen, traditional and religious leaders, the civil society organizations, state ministries of health, state primary healthcare boards, all health professionals, and our professional media community. We remain thankful to all stakeholders for the selfless services rendered thus far, and we kindly request that we continue to take up the responsibility of protecting Nigerians against COVID-19 by continually educating and sensitizing our communities with the right information and right resources in order to fully protect them from the deadly virus. On our part at the National Primary Healthcare Development Agency, we are supporting states to establish mass vaccination sites across the country. There will be expansion of vaccination sites to all public health facilities, be they primary, secondary, or tertiary. We'll be including private health facilities and setting up mass vaccination sites in populated areas such as universities, colleges of education, polytechnics, schools of technology, vocational institutions, stadia, motor parks, town squares, markets, shopping malls, to mention just a few. This process will not interrupt the ongoing vaccination services in the public health facilities. All designated health facilities should be vaccinating against COVID-19 as well as carrying out their routine services. We are leveraging on fixed and outreach routine immunization sessions and creating temporary posts to expand the COVID-19 vaccination service delivery. We are continuing to engage with stakeholders to promote awareness and vaccine confidence, and we have strengthened our accountability framework to reflect our principles of transparency in the handling of COVID-19 vaccination nationwide. Our best guarantee against COVID-19 for now is vaccination, and this is why government is committed to mass vaccination campaigns. We hope to vaccinate at least 50% of our population by the end of January 2022. We will be conducting the national flag off of this mass vaccination campaign this Friday, November 19, 2021, by 10 a.m. As part of our accountability measures, we would like to update Nigerians about a few of the cases we have investigated. There is a case of one Mr. Amako who attempted to travel outside the country with a vaccination card that could not be validated. Upon investigation, the reason for the non-validation was that the expiry date of the first and the second doses were altered. There were inconsistencies with the vaccine expiration dates and the batch number, and the QR code scanned belonged to someone else. This clearly showed that Mr. Amako illegally obtained the vaccination card without getting vaccinated. He was denied travel, and his case is still with the law enforcement authorities. Once we conclude the investigations, we will reveal his full name to the public to serve as a deterrent to others who would want to procure these vaccination cards. We would like to caution all Nigerians that any Nigerian found obtaining the COVID-19 vaccination card illegally, either buying or selling, will be made to face the full wrath of the law. The Joint Task Force on COVID-19, which includes security agents from the ICPC, the DSS, and other relevant security agencies, remain on alert at every corner of our designated health facilities and are regularly making impromptu checks. It will be extremely difficult to use fraudulently obtained cards to travel outside the shores of this country. In addition, and as part of our efforts to mitigate fraud and further enhance the integrity of our vaccination exercise, I am glad to announce that MPHCDA has commenced a nationwide operation Verify Your COVID-19 Vaccination Record Online. This exercise will enable you to confirm your personal information such as name, date of birth, and correct damaged QR codes. Verifying your personal information will enable government to secure your vaccination record against impersonation and other fraudulent activities. This exercise is also one of the ways we are checking the criminal activities of those who may have obtained the vaccination card without taking the vaccine. We will invalidate all COVID-19 vaccination cards that are illegally obtained by unvaccinated people during this exercise. This also gives international travelers the opportunity to verify their vaccination records well ahead of their travel dates. We therefore advise such persons to verify their records at least a week prior to their travel dates to avoid delays at the point of departure. However, newly vaccinated persons are advised to verify their vaccination records 24 hours after being vaccinated. To verify your COVID-19 vaccination records, please visit www.vaccination.gov.ng/verification guide and follow the instructions. If for any reason one is unable to access the website, simply call MPHCDA COVID-19 helpline on 0700-220-112 for assistance. I will repeat, if for any reason you are not able to access www.vaccination.gov.ng/verification guide, please call us on 0700-220-1122 for assistance. As you are aware, Nigeria currently enjoys relaxed COVID-19 travel restrictions in the United Kingdom. This did not happen by chance. It was due to the validation of the integrity of our vaccination exercise in Nigeria. We will continue to enhance the integrity of our vaccination processes and our vaccination cards. Finally, we would like to assure Nigerians, just like the chairman of the PSC just mentioned a short while ago, that the government has adequate doses of vaccines in the country. We just received 3.9 million doses of the AstraZeneca in batches between October 22nd and 25th through the COVAX facility, and also a combination of 1 million doses of AstraZeneca as donations from the governments of Germany, Switzerland, and Italy last week, again through the COVAX facility. The federal government has also received commitment of over 12 million doses of Pfizer and another 12 million of the Moderna COVID-19 vaccines. We have also received commitments of 5 million doses of Moderna as donation from the US government through the COVAX facility. We would like to also remind Nigerians that the federal government has procured about 40 million doses of the J&J vaccine. So pretty much between now and the first quarter of 2022, we are looking at over 100 million doses of the vaccine in the pipeline. That means the shortage of vaccine is no longer a barrier to accessing the vaccines, and you can go to the nearest designated health facility to get your shot. We now have the shots. We need the arms to get those shots into. If you are 18 years and above and you are unvaccinated, simply ensure that you make your way to the nearest health facility. The vaccine is free, it is safe, it is effective, and protects you and your family and your community from COVID-19. If you have taken the first dose, please check your vaccination card so that you can determine when you should get your second dose. Let me once again assure all Nigerians that the federal government is committed to administering safe, secure, and efficacious vaccines to everyone. Over 5 million Nigerians have taken the COVID-19 vaccine. 5 million Nigerians cannot be wrong. Permit me to use this opportunity to finally appreciate His Excellency President Muhammadu Buhari for his leadership and commitment to the health and well-being of all Nigerians. I thank you for listening, and we will continue to count on you for the success of our national effort to safeguard the health of our people. God bless you. God bless the Federal Republic.
What is going on globally? And as you heard from the Honorable Minister of Health, that COVID-19 cases are rising in Europe, some of the countries that have had a very high or significant level of vaccination. Our own numbers here for the last 4 weeks have been going down. This is the same situation we were in last year, where the number of cases dropped to less than 150 per week. We have to interpret this information with caution, because with the level of unvaccination that we have, with the low level of compliance to non-pharmaceutical and social measures, we are still not immune to having a very high number of cases in the coming weeks. This period of time heralds the end of the year, where many people who have traveled out or people who are based in other climes will now start coming back to this country. We have a positive correlation between number of passengers who are coming into the country with the number of cases of COVID-19 that we have recorded in the past. We therefore need to be more cautious. We therefore need to exercise more safety measures. We therefore need to be more vigilant to protect ourselves and our families from COVID-19. COVID-19 is not yet over. A possible fourth wave can happen. Last year, we saw how the entire wave started From April, May, June, we had our first wave. By November, December to January, we had our second wave. And by July, August, September, and up to October this year, we had the third wave of COVID-19. We need to continue doing the things that we know work. First and foremost at this time is to ensure that we improve our level of vaccination. And it begins at individual level, at the household level, and at the community. We therefore urge Nigerians to take this very seriously. The best way to protect yourself from COVID is to prevent it from happening. And science has shown that people who are vaccinated are highly unlikely to come down with severe disease or even to die from the disease. We need to improve on our observation of the social measures. Even if we are vaccinated, we still need to continue to observe the social distancing measures and continue to wear our mask. This is because a critical number in the population is still not vaccinated, and therefore we will help to transmit the virus even if we are vaccinated. It is therefore important that we take this caution. We are so lucky as a country that we have not had a number of cases that have overwhelmed our health facilities. But I tell you, those of us on this side always have this trepidation and fear that should that happen, what is going to happen to our population? It is the measures that we take at individual level, at family and at community level that culminates into us having either herd immunity or having less transmission of the infection in our communities. On the PSC level, we are using this opportunity to strengthen these measures, to strengthen our surveillance at the points of entry, to provide information and protocols and simplify the protocols for people who are traveling, to improve our quarantine processes for people who do not comply with the protocol, and also to implement some operational research that will help us understand and improve on the work that is already going on. Secondly, I will talk about the travel portal. The travel portal has been an important tool for passengers who are traveling back into the country to use to register themselves, upload their test results, and also complete the health questionnaire. It has helped us to vet and to sieve passengers who have symptoms that can be COVID-related, and it has also helped us to know passengers who are COVID negative before they board our flights. We have transitioned the portal from a former platform onto a government platform now, and it works seamlessly. We admit that there are some bottlenecks, there are some glitches, but these are being solved and attended to very regularly by dedicated technical team. A private sector-led consortium of private laboratories and logistics company is responsible for the management of the portal and also the conduct of the test results. The Presidential Steering Committee and the state governments are providing oversight to the activities of these laboratories and working towards a sustainable funding for the response. Thirdly, Mr. Chairman has informed you about the upcoming National COVID-19 Summit. After 9 months of implementation since we came as the Presidential Steering Committee, it's really a good time now to reflect and see where we are. What are the challenges? What are the missed opportunities? And how do we cut a way forward to build a sustainable health promotion, health safety, and biohealth security system for the country? The theme for this summit will be review, reposition, and push through the last mile to end COVID-19 pandemic and build back better, resilient health system. This summit is going to come up between the 6th and 8th of December 2021. We hope to invite all critical stakeholders, government agencies, states, the National Assembly, development partners, civil society organization, private sector, research institutions, and members of the academia to attend this important summit and help us review and chart a better course for the country. Lastly, I would like to inform you and the general public that the Presidential Steering Committee has been working assiduously to resume the flights between Nigeria and United Arab Emirates. You will recall that United Arab Emirates has reviewed their guidelines for entry into the country for passengers from Nigeria. The condition is a new condition that has not been placed on our country by any other country. We are working with them to implement step by step the requirements that are needed to achieve this objective. We have agreed to conduct a validation of the test, PCR test that is done 48 hours before departure, using a pilot exercise that will not last more than 10 days. During this period, passengers will go through 3 tests, 2 in Nigeria and 1 on arrival in the United Arab Emirates. We have provided all the information, logistics, and preparations that are required for this pilot to take off to the United Arab Emirates authorities. And we hope that any moment soon, they will set up the laboratories for this testing so that these flights can resume between the 2 countries. You will recall that in the past, these conditions were not agreed because we did not believe they were scientifically appropriate. But in the best interest of harmony, we have agreed now to carry on with these conditions. It will be a little hardship for our passengers, but we assure you that we'll do everything possible to protect the interest of our country and also ensure that Nigerians do not go through unnecessary hardship to travel to any other country. Thank you very much.
Virus in its in the response to stimulation for antibodies, and research is like going like wildfire. And if you develop vaccines, for example, in any country, there is also the possibility that, well, this vaccine, the immunogenicity, does it work better with black or with white people or with Indians, with brown people? So they usually will test it in many places because what will work in Europe or maybe even Northern Europe might not even work in Southern Europe. So they need to collaborate for researchers to work with each other. And among themselves is very, very high. And we are getting questions and opportunities for our research organs to also work with others. They are, for example, testing new vaccines in which we shall be involved too. And vaccines are going to be delivered not by injection, but by spray. And then again, you have to test. Well, how does it, in order to be able to spread it around the world, you must have evidence that it works the same way everywhere. Somebody asked a question just now that people do not seem to be dying here like of course, that's a good question, a scientific question. Why is it so? So people are conducting tests. They are conducting all kinds of assessments of your immune response in your body, whether it's active or passive, and seroprevalence. So the floor is wide open. And the same way, there's research going on medicines. What will work? And NIPRID is the Nigerian Institute for Pharmaceutical Research and Development. And you all remember when we got the big hope for COVID, which was called the Madagascar herbs, if you all remember. It's NIPRID we sent it to tell us what is inside. And it turned out not to be exactly what was thought. So it doesn't mean that that's the end of all herbs. It doesn't mean that none of them works. No phytomedicines exist. And since nobody has really found answers that work, after trying chloroquine, hydroxychloroquine, all sorts of medicines that came up at the time, a lot of it was guesswork. Some of it was based on hope, and some based on evidence that was not complete. So the research is going on, and NIPRID hopes and believes that they can find something. They have received a grant from outside the country, and also they also received a grant from within the government to put together a research plan, which they are doing at the moment. They have not brought out anything specific yet, but they're working very hard to, and it's a very well set up agency, to find, and they have received new equipment, I must say that, to find something that will work. And it has to be proven to work. The Institute of Medical Research is participating in clinical trials. Even if you find a vaccine that appears to work in your laboratory, you have to test it. And you get at the point after testing animals, you have to test with humans, with volunteers. So you have to do that with some other countries, as I already mentioned. NIMA is doing that, also testing the dose, what dose works best, and what interval works best. So there's a lot to try to find out in there, which we are involved in. And as far as the vaccines are concerned, we have a laboratory, not a government laboratory, that's the African Center for Excellence in Ede. It's headed by Professor Happy. It's a private sector, and we're working with them to find out what they're doing, to encourage them. I gave a letter of recommendation to them the other day on a project they're doing with American Research Group, and they also a recommendation for research with a group in Botswana. So there are a lot of international linkages going on where people are talking with each other, trying to find out the capacity of one or the other, and not knowing exactly where the answer will come from. It might come from a surprising place where you didn't expect. So this is going on, and the Nigerian who has a research center in Maryland, USA, has come up with a vaccine candidate. And there's an American company that's interested in working with him and signing a contract to test. This test, a phase 3 test, is very expensive. You need a lot of millions of dollars to do it. So if the money is not there, you can't conduct that test. You remain stuck with your vaccine. So the contract for that vaccine of the Nigerian in America is going to be signed here, and by the time it's signed here, we shall make that a public event for people to know about. So it is these things of which no single answer can emerge in a short time that we are hopeful for. Even the vaccines that we are talking about, as I mentioned in my speech, there's a new generation of vaccines that is on the way, because there are issues being found with this vaccine. Although it's a stable protein, the spike protein of the coronavirus is relatively stable, but still, it's not, they believe that there can be something better that comes out of it. And if you discover that the antibodies that it stimulates in you, they decay, that's to say they reduce faster than you would like, then you definitely will be looking for something better. So that's what we see on the other area of our research. For the drugs that you take without the vaccination, I am not, generally there are some in social media, so suggestions that don't take this, don't take that, none of them really prove. A lot of it is conjecture. But the ED of primary healthcare will also talk about that and say something more about what drugs, but generally that nobody's dwelling on, particularly on saying this is indicated, don't take this or don't take that. As far as the laboratories are concerned, I just say a word or two about it. The DG of NCDC can come and say more about it. A good number of these laboratories are privately owned. And if they decide to shut down and not work well, there's nothing you can do about it. They don't want to work, they don't want to work, either they have no reagents or they have no people. But the others that are publicly owned, they all report, they're supposed to be reporting their findings to the Ministry of Health, specifically NCDC, and to tell them this is what we have tested, this is what we have, the results we have had. Not all of them do report, so there is a strategy I was talking about earlier of engaging state governments, state commissioners, and state epidemiologists to find a way of stimulating sample collection, testing, reactivating laboratories, and getting them to participate in the entire picture. But if there's a huge need, then a lot of them will definitely come on track and begin to deliver more. So I believe those are the questions that arise. The research area is promising. I've spoken of NIMA, NIPRID, and the center in Ede. So private, government are all in it, foreign and local, they're all in the area of research and development.
From Amaka Ode, whether we're considering reducing the age bracket in terms of the eligibility for the vaccines. That is not a priority for now. We're focused on making sure that all Nigerians who are 18 years and above have access to the vaccines, and we're able to deliver on that. But in the meantime, there are studies that are going on to see, in terms of our context, whether we should be looking at those age groups, and then in terms of the requirement for booster doses. Second question was from Channels. You asked, how much the 40 million or so doses of the J&J vaccine cost. So each dose of the J&J vaccine cost about $7.50. So if you do the math, that should come to right around $298 million, $300 million approximately for those, almost 40 million doses, right? So Rachel asked about the scarcity of syringes. So these vaccines typically come bundled. So the vaccines will come with the syringes that are required to actually administer them. For those that do not come with the vaccines, the issue of the vaccine shortage, syringe shortage is not a challenge for now, but of course there are conversations in the country around how we can improve on local production of syringes that meet WHO and other global standards. You asked about the QR codes and how come people have access to them. So for people who fraudulently access the vaccination cards, more often than not, it is with collusion of the health workers, right? So the health workers have the vaccination cards and the QR codes, and they sell them to will-be buyers of the vaccination cards, okay? Then you said for people who take the first dose and maybe misplace their vaccination cards, what do you do? So there's a protocol that we've developed, and it's on our website, what the requirements are for you to prove, A, that the vaccination card was stolen, and then B, of course, that you actually got the first dose. So you will require an affidavit, for example, to swear that you lost the vaccination card, and then we'll be able to pull up your records from the database. This is exactly why we have an electronic database, so that those records are there ad infinitum. Then there was a question from NTA about okay, some people took the first dose and then they have challenges with the second dose. This was really a challenge, especially when there was some unpredictability in terms of the supplies. But right now, like I mentioned in my speech, we have enough doses to go around, right? It wasn't a situation a few months ago where people will come and then we said we're anticipating supplies. Right now, we have enough of the jabs. We're now looking for the arms. Thank you.
Sorry, you have to answer the question. I asked how many states and local governments have received the J&J vaccine so far. And then again, you asked us to do math, I've taken the liberty to do it. It's about 150 billion naira. Is that how much the federal government released?
I have no idea what the conversion rate that you have used translates to. Gloria, you asked me how much it cost. These vaccines are bought in US dollars, right? I've given you, it's $7.50. Well, no, in $7.50.
Development Bank said that they gave us spaces and they calculated the money that they got to that over 200 and something thousand for process. So I don't know what you have.
No, so if we step back a bit, your question is how much did we buy the J&J vaccine? We bought it at $7.50. We bought a total of 39,800,000 doses. If we do the maths, it comes to 298,500,000, right? US dollars. I do not know which exchange rate you have used, but do the math. That is what it comes to, right? Now, the $7.50 that we used eventually to procure each dose is as a result of some reduction that we got. Originally, in maybe, if you recall, there was a time when it was $10 per dose, but we got a discount eventually, and that is how it came to $7.50. So that also improved our opportunity to get as much as 40 million doses, here and there. In terms of the states and the local governments areas. So in logistics, there's what we call first in, first out, and due considerations for shelf life. Our plan at the Presidential Steering Committee, and I'm sure that we have communicated this clearly, is we will be prioritizing hard-to-reach areas, mountainous areas, riverine areas, conflict areas for distribution of the Johnson & Johnson vaccine. The Johnson & Johnson vaccine that we have received has an expiration date of 2023. It doesn't make any sense for you to be going around vaccinating people with a vaccine that expires in 2023 when you have those that will expire in 2021. This is just a matter of logistics, right? So we're looking at all of the landscape in terms of the vaccines that are available to us and using the principles of those ones that come in first need to be deployed and utilized. But apart from that, what I've also presented today is that we're embarking on a mass vaccination campaign to increase uptake, to increase access to the vaccines. So in the next couple of days, in the next couple of weeks, we will be trying to permeate every nook and cranny of Nigeria with the vaccines. It means that there will be greater access to the vaccines by virtue of the fact that we'll have mass vaccination campaigns in places where there are large populations, right? So places like motor parks, the markets, shopping malls, right? And then we will also increase the number of public and private health facilities that have these vaccines. When we started in the first phase, we did not give vaccines to the private sector. And even with the public sector, we only used a subset of those public health facilities in order to match the numbers of vaccines that we have with the designated health facilities. There was no way we were going to distribute vaccines all over the place to health facilities when those health facilities probably will see only 2 to 3 clients. Once you open a vaccine vial, you have to discard it after 6 hours, whether or not it is completely utilized. So we have to be very careful about how we manage the logistics of this so that we reduce the wastage rate of our vaccines. This is what we're doing in order to ensure that these vaccines are utilized only at the point where they are going to be optimally useful to Nigerians.
But just to gain clarity, you said you have procured. When are you going to commence distribution of J and J? Have you commenced already?
Yes, in those places where we have designated as the areas where we're going to use some of these vaccines, we have selectively used them in some of these areas based on the release. So, for example, we have deployed to at least states like Borno, where we have the insurgency. We have sent some doses to Rivers State. We've sent some doses to some places in Bayelsa. But I want to emphasize that our priority right now is to finish those vaccines that have a shorter shelf life rather than the vaccine that has the 2023 expiry date. And we have started receiving doses of the J&J vaccine, right? I know so far we have received over 1 million doses of the J&J vaccine. But our focus is to first finish those vaccines that have a shorter shelf life. I'm repeating this so that next week you will not say that J&J vaccine is the one that you are interested in.
J&J requires 2 doses now, so are we still going to continue with 1 dose? Even the companies are saying that you need 2 doses.
Okay. Yeah, thank you very much, Rachel. I mean, obviously you are up to date, right? What the science is showing us is that in all likelihood, those that have taken the first dose of the J&J are likely to require a second dose. That is what the science is depicting. But there has been no formal communication that this will be a policy. So there are still additional research that is going on before we take a decision to say, yes, they need 2 doses. So this guideline or position was from a few studies on the immune levels of the vaccine. For all you care, even those vaccines that were originally stipulated to be only 2-dose vaccines, we're now seeing that there is a requirement for a third dose or a booster dose. So it will be, not surprising if you have to give a second dose for the J&J vaccine. But for now, it's a single-shot vaccine. Thank you.
So could you also confirm there are medications?
No, for now, there is no specific contraindication in terms of any medication that you should not take when you are taking the vaccine. But ultimately, that decision for some conditions, right, that requires a discussion between you and your health provider, right, you need to. But on a general basis, there's no drug that subsists as a drug that contraindicates vaccination, okay? Thank you.
Thank you very much. Executive Director, National Primary Health Care. Just a riverine area, since you have also mentioned some parts like River State and Bayelsa. Thank you.
So for every state of the Federation, we're working with the subnational level, and it is those people in the states that know where Gegu is or wherever, or is it Gembu? Gembu, okay, yes, Gembu, yes. Yeah, I think I've been there myself. Those are hard to reach areas, right? But you cannot come from Abuja and know, the Gembu better than the people who live around there. One thing is for sure, we're working with the states. They've developed micro plans, right? So they understand all of the areas where people live, right? And I can assure everybody that no matter where you live, there is a designated health facility close to you, right? We have gone all across and mapped all the health facilities. And in the next couple of days, we will be publishing the nearest health facility to your house. So whether you are in Gembu, I am sure that the Ministry of Health in Taraba State, working with the state primary health care boards, will have identified the nearest health facility to you. But beyond that, there are also temporary teams that will move from the health facilities to as close as possible to where you live. Again, this is not something that is completely new. This is exactly what we did with the polio eradication program, making sure that we took vaccines from house to house. But we will also be taking these vaccines from settlement to settlement, right? And making sure that all of this happens. It's not something that is going to happen overnight, but it is something that we're committed to doing. This is really why we're going to be having the launch of the mass vaccination program by Friday, to distinguish it from the phase 1, where there were just a few number of designated health facilities. Now we're bringing the vaccines as close as possible to where people live and work.
Gentlemen, it looked like anybody got the memo that this is my first press. Okay, anyway. Thank you for really those very, very good questions. I would answer all of them, not in any particular order. So the question about deaths and vaccination, and also related to that, breakthrough cases. So I simply added figures from September and October. So these are deaths from September and October in the surveillance database for people with vaccination data. So what that shows is in 2 months, where we had 145 deaths reported from 5 cases, 81% of those deaths were in people unvaccinated. Yes, unvaccinated, okay? 3 and 4% were either partially vaccinated or fully vaccinated. And those, as you know, actually represent breakthrough cases, okay? So that's the answer to that one. Regarding the labs and testing, and obviously one of the achievements we are proud of, and the NCDC, is the ramp up in testing capacity. When you have 0 results, it doesn't mean that it's a combination of, yes, some tests were not done, and tests were done, but nobody was found positive in the period, just to make that distinction. But we are, it's not just citizens that have pandemic fatigue. So health centers, people, health facility labs also suffer the same. And we've spoken earlier today about our plans to actually re-energize testing efforts in our network of labs and even those that don't belong to our network, both through PCR and, of course, rapid diagnostic tests. There was a question about seroprevalence. I actually didn't mention seroprevalence, which are, seroprevalence is what you measure using tests for antibody. I was talking about rapid diagnostic tests to actually identify infection. But since you brought up the question, and it's a subject I'm interested in, we had seroprevalence surveys in, I think, 4 states 6 to 7 months into the pandemic. So this was September, October 2020 in Lagos, Gombe, Enugu, Nasarawa states. Now, for 3 of those states, seroprevalence, that is the proportion of the people tested who had antibodies, which means they've mounted an immune response because they've come in contact with the virus, was 20 to 25%. Lagos was the highest at almost 24%, which meant at that time in September, when we were only reporting few cases, actually, almost 25% of people in a population tested in Lagos already had encountered the virus. This is a major difference between the cases detected and basically community exposure. So although that was higher than the cases reported, but what it still showed was that up to 75% of that population were still susceptible to the virus. And of course, we saw what happened in subsequent waves. Gombe State had the lowest, about 10% seroprevalence. But what is important to highlight beyond the discrepancy between antibody testing and cases is that that was in September, October. If we test now, so we are still, so that was the first survey. We have had a subsequent round done. And actually what we hope we can do with some of the new support that we may get for the COVID response, actually have nationwide survey. Now, the important thing to note is that actually one-off surveys are probably not as useful as you want them to be. So in my previous role before I got here, I was responsible for a series of surveys, seroprevalence surveys in another African country, in blood donors, in different populations. And we did it literally at intervals for every year. So we could track from when seroprevalence was 5% to 75, 80% in some populations. So this needs to be a continued effort, and we intend to the extent that it's possible to make it a continued effort. Obviously, it's a big country, widespread geographically. Sorry? Okay, so that's the for labs. So somebody asked if I believed in natural immunity. I think it was. Of course, natural immunity is, it's the way we were created. We have an immune response that is trained to react when you come in contact with foreign pathogens. And before the advent of, even antibiotic therapy or even vaccines, basically life was like a lottery. Okay, you come across a pathogen. If you are lucky, you have a good enough immune system, you overcome it, you recover. If you are not, you die, or you have complications and may have to live with what we call sequelae. Now, what we know for most of the, for diseases that are vaccine preventable is that we would rather that you acquire your immunity through vaccination. Because vaccination does the same thing. It gives you some form of exposure to the pathogen you're interested in protecting the population against. They develop an immune response. And therefore, when they actually encounter the proper bug, there's less of a chance of an adverse outcome. Now, the thing is, if you allowed people to acquire natural immunity to polio, then you have many people who are going to have complications of polio. And I'm talking about what you see, because what people don't seem to forget is that polio actually killed people. Okay, most people are used to, maybe when if you are that old, if you are old enough, you will remember going to primary school and having a lot of classmates with special shoes, with braces and all of that. And the reality is that we actually see less of that these days. And that's, if there's nothing better than that visual as a description of the fact that vaccines actually work. And that's exactly what we are saying, that for SARS-CoV-2, we've played the lottery. Okay, we have been extremely lucky across almost all of Africa. So it looks like the pattern of the pandemic in Africa, just above Republic of South Africa and below the Northern African border, has been completely different from what was predicted. Okay, but we know a few things. The disease has behaved exactly the same way here for high-risk populations as it has done elsewhere. The elderly here are susceptible. Those with comorbidity are susceptible to severe infection, severe disease. And that's exactly the same way it has been everywhere. Now, there are a few hypotheses for why the pandemic has behaved differently here. And of course, one of them that seems to be really obvious is that the African population is younger. Okay? If you look at the population pyramid in Nigeria and actually start off, let's not do population pyramid. What's the life expectancy in Nigeria? Okay, so if you have if you are in many countries in Africa where the average life expectancy, I'm not talking about we privileged people in the room, the life expectancy is 60, then it means that your aged population is a very small fraction compared to places like Italy or Spain that had 20%, 25% of their population 60 or 70 and above, now exposed to a novel pathogen that they've never encountered before, alongside all the usual problems, diabetes and other lifestyle diseases. So the demographics is all that we know for sure that may have contributed to the difference in the way the pathogen has behaved here. People think, oh, there are hypotheses about, maybe pre-existing immunity. We've not found anything. So we are clearly lucky. Now, the question is, how much further do you want to ride your luck? The virus is here. Seroprevalence studies tell us that it is more widespread in the community, which means that even if we have a disconnect between infection and cases and deaths, we do not have a disconnect between community transmission. So variants of concern can emerge here. In fact, we've had a variant of interest that emerged both here and in the UK, and that, quote unquote, we may have exported to Denmark and other places. But luckily, it's not behaved like the Delta. So that just alerts you to the fact that if you get another variant that is as bad as Delta, that we have no protection against, then we have another wave and it spreads around the world and we have problems, which is why we cannot ignore the presence of this virus or ignore the pandemic, even if our hospitals are not filled with very sick people and the morgues are not filled with dead people. I think those are all the questions I had. I'll just look at my notes one more. Yes, I think that's really what we've had. So unless there are any questions I've missed, thank you very much.
So let me just be test introduced for the pilot. Yes, Emirates is going to pay for that test, for the passengers that are going on Emirates airline. Secondly, Nigeria has taken an extra caution, which I'm not aware any other country has taken, in terms of validating the tests for outbound passengers from Nigeria. We did an exercise with all of our private labs that are issuing these results, and we have a validation process through the NCDC, where every result that is being issued by the private labs for traveling is endorsed by NCDC, meaning that NCDC is sure of the quality of that result. To my knowledge, Nigeria is the only country where the government puts its neck on the line and say that this is what is going on. Many countries were not aware of these additional steps we have taken, but we have taken it internally so that we can give credence to all the test results that are issued out of our country. At the time when UAE was having fake results from Nigeria, over 90% of the passengers who are returning to Nigeria from UAE had fake results. What we did was we took steps on our own side. We made sure that if we detect it as a fake result, that you are not allowed to go into the city or to go to your destination. You are taken into quarantine. And therefore, we mitigate it here. So it is very important. We tried to bring this up in the discussion with UAE, but it looks like they were worried about the fake results coming out from Nigeria. But the results we are getting from UAE, though they are Nigerians returning, over 90%. We even had a syndicate at Dubai airport where people issued the results there and then. We had to work with our Foreign Affairs Embassy and our staff in NIA to actually bust out that syndicate that was issuing the results. And the issue of fake results is not limited to Nigeria. We have seen it from many other countries that people come. People, when they're in a hurry, when they're desperate, they try to do a lot of things, to try to beat the system. So as an advice for our passengers now who are returning to the country, please do not wait until when you are about to start boarding before you complete your NITP portal and upload your results and then make your payment. There is every likelihood, even if you are close to your bank here, in Area 3, if it is GT Bank, you make the transaction and it will take an hour or two before that transaction actually reflects, especially if it is a different bank. So people should be cautious and do that earlier. Nothing stops you from completing your NITP a day or 2 days even before you travel. As long as you have your COVID test result, you can go online, complete your form, make your payment, and wait 3 to 4 hours. If it will take time, for the payment to go through, you do that before you travel. But many passengers come to the airport just when they are about, to get their boarding passes. That's when they try to now log in and get it. A lot of the complaints we have received, people will call us and say they're having problem, that it is not going, payment is not going through. 10 minutes later, the payment has gone through. Because of the anxiety, you want to board now, and you see that the gate is about to close. So we urge Nigerians to please do this process early on so that if there's any problem, you can even raise it. Any payment that does not go through within 12 hours or 24 hours, it's justifiable that you make a call and find out from your bank, or you call us to find out what's going on. The PSC has not given up on enforcement, and I tell you that it is yielding fruits, although it is not happening at the level that we had wanted. But Lagos State has worked with us. They have developed a framework now, and they have a legal system where people who are caught, people who are mostly dealing with people with fake results, or whatever, all these issues that are happening around the airports, they go through the prosecution system. And I know that over a dozen people have been fined in Lagos State. The process is also going on with FCT. They're trying to set up that legal system. It is a slow process, but certainly if you want to prosecute people, you have to do it legally. Thank you.
So just to clarify, Emirates is paying for all 3 tests for Nigerians who can.
No. So there are 3 tests, okay? One is you do the test 48 hours before departure. That is paid by passenger. It's like traveling to most other countries where they require PCR, so you pay. Most countries require 72 hours, okay? UAE requires 48 hours. So the passenger pays for that test 48 hours before departure. But the testing that is introduced now, which will be done 8 hours before boarding, that is the one that Emirates will pay for the passenger. And also the test that will be done on arrival at the arrival airport in Dubai, yes. That one will be done. No, we have a national airline. Air Peace is also taking passengers from Nigeria. Air Peace, yes. Air Peace, the passengers can still travel with Air Peace to UAE, and they'll go through the pilot program. But in this case, the passengers will have to pay because UAE introduced this condition. They introduced this condition, and as what will I say? As a relief or whatever, they agreed that the passengers will not pay for Emirates Airline. So the airline now will pay for the test. Thank you.
Thank you very much for this detailed.
Thank you. I think there were 2 questions that were directed at both myself and other colleagues here. One is whether we have lowered our guards in terms of enforcement. If you have followed quite conscientiously how we have placed the protocols in place, the issues of enforcement have always been left with the subnationals. I can't police the whole country from here. It is the responsibilities of the subnationals who also sign the quarantine regulations for their states. And in those quarantine regulations that are there, so those issues of enforcement are the responsibilities of the subnationals. And we're still working along with them to see how best we can in place some of these protocols. We are working with the Governors Forum to ensure that the vaccine mandate that we have introduced for federal public servants are also considered by the governors for implementation in their various states. You know that some governors have even gone ahead of us and in place these measures. And I believe it is all for the good of our people. And we'll try as much as possible to continue to encourage Nigerians to comply with the non-pharmaceutical measures that we have in place, because so far, that is about the best safeguard you have. You've listened to the stories of people who have been doubly vaccinated and who have also contracted the COVID-19 virus, and eventually some have even died, unfortunately. But I believe the best safeguard you have is the non-pharmaceutical measures that we have preached over the last 1.5 years. Wearing of masks to cover your nose and your mouth, ensuring that your hands are sanitized or you wash them, keep social distancing or physical distancing, and avoid mass gatherings, except if it is extremely important. Don't travel, particularly to crowded environments and places where people have decided to totally throw caution to the winds, because you unnecessarily expose yourself in trying to ensure that you just attend to social gatherings. I believe that we are on track, but we must begin to look at best global practices. As people are learning from what we are in place in Nigeria, we should also look at what is happening in other areas, because COVID-19 has proved that no part of the world is safe until all of us are safe. And we must try to do everything humanly possible to ensure that we protect our people and minimize the adverse effect of COVID-19, either in the health sector or in the economic sector. And that is what we are trying to do. Mitare, you did ask, truly there's so much still left undone. And the knowledge about COVID-19 keeps improving. The management of cases keep improving. And I believe that the issues of vaccines, if you pay and you read up a lot of what is happening globally, very soon we'll have vaccines in abundance. So vaccine shortage is not there again. We have 12 million now in stock. We are asking people to provide their arms so that they can take the jab. There is so much of vaccine hesitancy still. So we have to ramp up our risk communication and try as much as possible. We've discussed today to begin to look at the prospects of even booster jabs for people who fall into the category of the vulnerable, the aged, and those that have underlying health conditions, so that we can enhance their immunity and make sure that we preserve lives and livelihood. I believe with your support, that of the media particularly, we should be able to drive home this process and ensure that our people are ready to participate in this mass vaccination exercise that we are rolling out on Friday. Because that's the only way. If you look at the sciences and the data that is coming out of other countries, particularly in Europe, Eastern Europe, most of the countries that have the least vaccination percentages are the ones that are having the very outrageous surges in infection. But even in countries where the vaccination had reached a certain proportion of the population, because they lowered their guards in terms of setting aside some of the non-pharmaceutical interventions, which are very, very important. You get vaccinated, still keep your mask, because you don't know the people you are coming in contact with, whether they are vaccinated or not, or whether they are infected or not. It is not written on the foreheads of people. So in a couple of countries, I've seen surges in the numbers. But if you look at also how are they dealing with their protocols, you realize that they've opened up mass concerts, like the one that happened in the US just about 2 weeks, about a week or two ago, where they ended up even with fatalities as a result of the surging of the crowd to get to the podium where the musicians were performing. And I didn't see a single person wearing a mask in that gathering. So if anybody was infected in the midst of that heated and passionate surge on the population, there would have been transmission, a local transmission in that crowd. And those people will return back to their loved ones in their homes and get them infected. And that is how you keep the surge in the figures up and up and up. Let's not forget, COVID-19 has taken the lives of over 5 million people globally. 5 million is not a small number. In 1.5 years, 5 million people have died. This is for where they keep the statistics. Don't talk about countries where we don't have very good record-keeping sessions. There are so many people that have died of COVID-19 in Nigeria that we have not recorded, because they die and the people in the villages and in the towns will say that, well, probably people from his village are the ones that pursued him to the city and killed him. We have all sorts of explanations to give. But I believe strongly that working together with the media, we should be able to accelerate this mass vaccination exercise so that we can reduce to a large extent the adverse effect of this COVID. Rachel, you did ask how do we deal with businessmen that come around? It's a matter of perception of the risk that is exposed. I've made it a point of duty since this COVID exercise started. You can't access my office, whoever you are, if you're not wearing a mask. You can't. There's no way you can come into my office without wearing a mask, because I'm always masked. So what justifiable reason do you have to tell me that you are not going to wear your mask if you are going to come into the office? I have a duty to protect myself first. So I won't indulge you. I have to protect myself first. And consequently, by the time we get to the point, by the 1st of December, we are starting with public servants, federal public servants. And I believe by the time we meet with the Governors Forum today or anytime soon, and they adopt it, it means that it's going to be a national policy of vaccine mandate for public officers. And for those of you that have traveled and are traveling, even in the media, you attest to the fact that countries are imposing specific protocols. From the 9th of November this month, you can't go to the US without being fully vaccinated if you are not a US national. That's a mandate. So it means that as a Nigerian, as a European, if you are not fully vaccinated, you won't have access into the United States. They have allowed a window for their nationals, but very soon that window would also close, because there are airlines that are demanding that their workers must be fully vaccinated. When they deal with that, they will now begin to impose that if you are not vaccinated, well, we can't take you on our flight. So it's a heavy responsibility of wanting to balance lives and livelihood. And we are not going to do anything less in this country, because we have a responsibility as the Presidential Steering Committee to balance that and to ensure that we protect our people. Thank you so much for your cooperation.
Thank you very much, the Chairman of the Presidential Steering Committee and the Secretary to the Government of the Federation.